Hi, everybody. My name is Dylan George, and today I would like to chat with you about some technologies that could enable public health interventions, technologies like contact tracing. Now, first, to give context, COVID-19 continues to impact the world. What you see here is a chart from our world and data. On the x-axis, you have a number of cases since a country has reached 30 cases per day. On the y-axis, you have a log scale of cases through time. And this is just a simple way of normalizing or being able to compare a range of countries. And what this is showing is that a handful of countries, including the United States, have been able to bend the curve. And in short, physical distancing is working to slow the spread in many areas of the world. And that's an exciting accomplishment and something that we should be proud of. The one thing about this figure that is a little bit concerning is that the United States in particular, you can see on the top of the chart, has flattened its curve. The United States is what's a lot of people are talking about this as the United States has plateaued. Now, what this tells us is as a nation, we need more effort to control the spread. And one of the things that I wanted to talk about today is until we have vaccines or other medical countermeasures, but primarily vaccines, they are the long-term solution. Until we have vaccines, public health measures or public health interventions are the tools we have for fighting COVID-19. In particular, today, we'd like to talk about one particular public health intervention, that being contact tracing. What is contact tracing? Contact tracing is the process to identify cases and help those that they potentially exposed manage their risks and self-isolate to stop follow-on spread of the virus. In short, it is trying to find the next generation of cases before those cases spread the pathogen broadly. Now, contact tracing is a bread and butter function for public health. It is an essential function. It is done successfully for a range of infectious diseases like Ebola, tuberculosis, and HIV. How is it done? I like to glibly describe it as a person with a clipboard and a can-do attitude on the phone is doing contact tracing. This is not completely accurate, but it's also not that far off either. This is a slide showing the a generalizable workflow. There are the functions that need to be done to make contact tracing work. There are three big buckets of efforts. First, there's the blue line, which is the case identification effort. The green arrows are the actual contact tracing sorts of lines of effort. The blue arrow is what's referred to as care coordination. And so there's this idea that if someone pops positive for COVID-19, you have to help that individual know that they're sick, help them get treatment, and help them do what they need to do, but also identify who they may have had exposure or who they may have exposed recently. Then you drop down to the contact tracing team, who actually goes out and tries to notify those that have been exposed, get them into an interview and see if they've exposed anybody else, help them get care so that they can stay in isolation and self-quarantine for a period of time and move forward. And then also, trying to coordinate those teams, the case identification teams, the contact tracing teams, and the care coordination team, trying to coordinate those folks is all a process to move forward. This process typically takes days to weeks because traditional contact tracing is a manual process. Now, for COVID-19, this poses a challenge. Modeling studies have shown that faster contact tracing is needed to curb the spread of COVID-19. And one model in particular, Oxford researchers demonstrated that traditional manual approaches to contact tracing would be too slow to control the epidemic. So what are the solutions to faster contact tracing for COVID-19? Well, there's two options, two big options that are being pursued. The first one is public health agencies are talking about workforce, or rather, how to do the manual process, but do it with more people so that you can scale efforts. In short, how do you build an army of contact tracers? In this particular slide, some colleagues at the National Association for County and City Health Officials have put together an estimate of how many contact tracers you need in particular states, and did a very diagrammatic map of the United States to show where more effort was needed to build the army of contact tracers. In short, this map shows us that we need to continue and double down on these efforts to build that army of contact tracers, because we're not ready for it yet, because we're not met. Now, the second idea that is being, it's not only just building the army, but technologists are talking about how to use technology to scale efforts. Use technology as a force multiplier. In this slide in particular, there's technology tools for contact tracing, and there's a range of them. And this is just an example of a handful of them right here. Customer relationship management software like Salesforce, and others are ways of making teams move more effectively together and work together more effectively. Exposure notification sorts of capabilities are something we'll talk about in more depth later on. It's a type of application that it can work on this. Symptom tracking, knowing whether or not somebody has the particular symptoms for this disease. Wearables can help. Our devices that are on people's bodies that can take biometrics, and we can understand different things about them, can potentially be helpful in here. Digital surveys and telemedicine are another ways of doing parts of that workflow that we talked about earlier. Now, this is a range of technology tools. There's a handful of others, but these are kind of some of the main big buckets. Now, what we did is we put together to try to think about, well, okay, the types of technologies we put in as the rows, and then we put as a representation of the types, the workflow across the columns in this particular table. And to try, and the check marks in the boxes within this are demonstrating that this type of technology can actually enable that particular functionality in the workflow. The main point here is not to get too wrapped around the axle in terms of thinking about, is this the right representation of what particular technologies do? But the main point here is that not any one particular type of technology can do all the functions that are necessary for a contact tracing capability, but rather you need to have multiple types of technology to move in concert to enable the capability of contact tracing broadly. That's one of the big points to take away from this particular chart. Now, there's been a lot of discussion in the media recently about a particular type of technology for contact tracing, and that technology has become known as exposure notification. And Apple and Google are perhaps the most well-known of a large group of people that are trying to develop capabilities in this space. And Apple and Google have developed a specification that would allow people to use their platforms to develop these types of apps. And so what is exposure notification? Exposure notification, it works in the following ways. Exposure notification is a mobile device emits a Bluetooth signal or some other signal, then another mobile device in its reach and in its receives that signal, and they both log a contact event of some sort. This log is encrypted. If either owner of the mobile device tests positive for COVID-19, then a communication can go out to all the individuals on the log warning of an exposure event. And there's a couple of variations of this. And that log can be centrally located or decentralized in a peer-to-peer way. And so there's a couple of variations of how this does. But the main point here is that it can happen nearly instantaneously once that message goes out. So you don't have to wait days to weeks, but you can do this instantaneously. And so you're able to work at speed and at scale in a way that you couldn't with a manual process. So So this has exciting advantages in terms of speed, but there are some challenges with it as well. One of the biggest ones is something that's referred to as the network effect, or the number of people that are needed for the capability to have value. It's what is that critical mass of people using the app for contact tracing for it to really be valuable and useful. And it requires a wide adoption for it to be successful. And so you need to have this voluntary installation on mobile devices. And one particular kind of a colleague of mine that I used to work with in the White House and the Office of Science Technology Policy put together a really interesting kind of a assessment of this as well. If you think of 1 in N adoptions of these sorts of capabilities on a phone, then you would only be able to record 1 in N squared exposures. And so if you have a 50% adoption of on phones, you'd have 25% exposures recorded. Now, if we're thinking that 80% of the United States has have mobile devices or smart devices that we could use in this capacity, that gives you an outside envelope of how many exposures could potentially be recorded. Now, of course, modelers have been thinking through this in terms of, is that sufficient threshold to get to move things forward and to be effective, and there'll be discussions on that as well. But it does give you a sense of there's a limitation as to the number of exposures that could be recorded. And then lastly, there's privacy concerns associated with some of these capabilities. There was an early stage group within North Dakota in the United States that tried to implement a capability very similar to what we're talking about with exposure notification. And there was a data spillage associated with it, which caused a chilling effect across a handful of different public health agencies. Now, and so the reason that this privacy concern is an issue is because whether or not people are willing to actually adopt and use these technologies will be really critical. Unfortunately, Americans do appear to be somewhat skeptical of contact tracing technology. There was a recent polling data that showed 50 to 70% of people are not willing to use contact tracing apps on their phone. And if that kind of attitude persists, that will tell you again, what is the outside threshold of how many contacts could you actually log using these kinds of apps. Now, the one thing I did want to make mention of as well is that, the code base associated with most of these exposure notification sorts of apps is relatively new within the last 3 months or so. And so a lot of these capabilities that are being developed for exposure notification are relatively new. We need to determine whether or not they really are fit for purpose. We need to test these technologies. Do they really enable contact tracing or not? Or is it just an interesting sort of sidebar distraction, as some people have called this? And so we need to find out ways of actually testing these capabilities. We need to establish really good evaluation metrics. And then also we need to learn from those that have already deployed these capabilities. Interestingly enough, Europe and Southeast Asia, countries in Europe and Southeast Asia, are about a month to 6 weeks ahead of the United States in terms of developing, deploying, and using these capabilities. So in the United States in particular, we need to figure out how to learn from their experiences, and we need to determine whether or not it is fit for purpose for us in the United States. Now, given all of these concerns, likely exposure notification apps will be adopted in the United States, more than likely in some places. But as I already mentioned, they probably will be at a slower pace than what we've seen in other countries because of all the reasons that we just discussed. Now, the implications of this slow adoption, really remain to be seen. It's not completely clear. Are we going to be able to build that army? Can we do it at scale? And will we be able to move forward? But as I mentioned before, places that have strong public health capacity to do contact tracing, they have been effective at slowing the spread of the virus. And that's why, at In-Q-Tel and in B.Next, we have been exploring this area. We've been connecting public health with technologists and technologists with public health colleagues. And we've been trying to help build the capacity to fight COVID-19 in no small part because we understand that it's very clear to fight COVID-19, we need the ability to test, to treat, and to isolate. And this capability will need to be robust until we have a vaccine, and we more than likely will not have a vaccine in the near future. And so that leaves us with these public health efforts. And so that's why we're so dedicated and committed to trying to push these things forward. And with that, I will stop. But thank you very much for your attention, and look forward to future conversations with you.